Hello, my name is Mackenzie Hagan, and I'm a doctor of physical therapy student at the University of Kentucky. Today, I'm going to be discussing levels of recovery centers in the state of Kentucky for people ready to take the first steps towards overcoming addiction. FindHelpNowKentucky.org is a CDC-funded database that allows people, whether that be an addict, a loved one of an addict, or a healthcare provider, the opportunity to locate resources around the state. Upon accessing the website, the form on the right of the screen will appear, which will allow the searcher to enter information based on who needs help, the region of Kentucky they live in, the type of treatment center, and the form of payment. What is nice about this tool is that failing to select a choice in each drop-down box doesn't hinder the searcher's ability to access resources. This form, as well as the website as a whole, is very user-friendly and provides up-to-date information on hundreds of facilities across Kentucky. Over the next few slides, I'm going to touch on the 4 primary levels of recovery centers. They are withdrawal management, also known as detox, residential treatment, intensive outpatient, and standard outpatient. Phase 1 is withdrawal management or detox. This phase typically lasts 3 to 10 days, but the duration is highly dependent on the types and amount of substances an individual has in their system upon entering treatment. In detox, 24-hour monitoring and in-house medical care is provided to all residents. Daily check-ins with a counselor are required, and the attendance of support groups is suggested. However, due to spectrum of detox severity, it is understood that not all residents detox in the same way. Therefore, there is no minimum or maximum number of group sessions that a resident must attend during this phase. Phase 2 is known as residential treatment. The duration of this phase is ultimately based on medical necessity, but it typically lasts between 21 to 30 days. As with detox, in-house medical care and 24-hour monitoring is provided to all residents. Residents will have one-on-one meetings with a counselor. In this phase, attendance at 15 hours of group session per week is mandatory. Additionally, medication-assisted treatment, which I will refer to as MAT for the remainder of this presentation, is made available to residents. Examples of MAT are Suboxone and Vivitrol. Phase 3 is intensive outpatient. Duration of this phase is typically anywhere from 6 to 12 weeks. Individuals in this phase are required to attend group sessions that last 3 hours 3 times a week. MAT is offered to individuals in intensive outpatient once approved by a doctor. In Kentucky, state law requires monthly counseling for those receiving MAT. Additionally, MAT can be taken home once approved by a doctor and counselor. The last level of recovery is stage 4, known as standard outpatient treatment. There is no limit on the duration of services at this level. Just as in intensive outpatient, individuals can receive MAT so long as they attend monthly counseling appointments. At this stage, a variety of individual and group meetings are offered. One of the most common questions that those seeking help for addiction will ask is who pays for it. Most private insurances like Anthem and Humana cover substance abuse programs. Policies do vary between insurance companies, but most commercial insurances will offer some form of coverage. In Kentucky, all Medicaid insurances cover services related to substance abuse treatment. When searching for the right treatment facility, whether it be for you, for your loved one, or for a patient, it is important to consider a few questions, such as the ones I have listed on the right of the screen. Gender-specific treatment facilities may be important to consider if an individual has experienced some form of trauma at the hands of the opposite sex. Medication-assisted treatment is something to consider as well, as all facilities may not offer it. For women who are pregnant, certain facilities are accommodating to the needs of a mother-to-be while she is in recovery. Faith-based versus non-faith-based is an important consideration as well, depending on where someone is in regards to their personal spiritual journey. Other services, specifically physical therapy for those dealing with chronic pain, should be researched when choosing the right treatment facility. Lastly, I wanted to include some incredible resources to conclude this video. After viewing this, you, your loved one, or your patient may not be as ready to take the next step towards recovery as they originally thought. These 3 resources will lend an open ear and heart whenever that time comes. Thank you.